Hi, why are nurses migrating out of Africa? Why are nurses leaving Africa to work in Europe and America? What is the reason behind the mass exodus of nursing immigrants? Why is nursing migration going on? Hi there, my name is Priscilla Kuma. Welcome to my channel. Subscribe, share, you know the drill already. And thank you to everybody. We have over 100 videos and over 620 subscribers. Yay, we're getting there. Thank you. So now I'm sure you know a single nurse in your life who has left Africa and now working in Europe or America or somewhere outside the country they grew up in or trained in. On top of these African countries, you already know the culprits. Give it up for the two West African countries that work hand in hand anywhere when it comes to sports, food, everything. On top of that list is Ghanaians and Nigerians. Ghanaians and Nigerians are migrating and living in Ghana and Nigeria as soon as the opportunity comes. You know Nigerians love to travel. There's nowhere in this world that you will not find a Nigerian. And Ghanaians are picking up on that trend now and getting out. So let's go back. Let's take a couple steps back. Why are nurses leaving their home country? On top of the list, I can just say three main things. One, salary-wise, the pay is not good. The work is hard, but the money they pay you doesn't correspond with what you put in. Two, bad working conditions. The systems are not working and people are fed up, so people want to get out. People are seeking for a better life, to put it quote unquote. People are seeking greener pastures. Yes. And the third one is lack of professional development. Nursing is very broad. There are so many aspects to it. There are so many units and departments you can specialize in. But unfortunately, most of these specialty courses are not found in most of our schools back in Ghana, Nigeria, or other African countries. The options to specialize are very limited. So if you want to do something that is not available, you just have to travel outside to get that education. And in traveling outside, you finish school and you remain there and you get stuck there, you never go back home. So low income, bad working conditions, and lack of professional development, career progression. Yes, that is why people are leaving. These top three reasons are why people are leaving. But there is concern raised now about the alarming number of healthcare workers, not just nurses, healthcare workers that are leaving Africa to go work in UK especially. And they're leaving West Africa, Nigeria and Ghana to be precise, to go work in UK. The number of people who land in Heathrow Airport every day as healthcare professionals to work in UK is very alarming, and people are now talking. I'm sure you've seen the trend and the discussions ongoing. And are you worried? Are we losing our staff strength in Africa, in our hospitals? Are you worried that you have the intention of migrating and they might lay an embargo? Anyway, let's discuss this and see. So I'm going to read something to you from ICN. Let me read this to you from ICN, okay? The Chief Executive of the International Council of Nurses, ICN, International Council of Nurses, Howard Cotton, has raised concerns over nurses leaving countries like Ghana and Nigeria to work in the United Kingdom. Nurses from countries on the WHO, World Health Organization's red list, where active recruitment should not be conducted, have been called for to be investigated. So WHO has some countries on their red list where you cannot recruit nurses from there. Yes, and that in my previous video about why nurses are not being recruited out of Ghana and some African countries is because of them being on the red list. They feel that a number of midwives they have do not match the need or the demand. So they don't want midwives and psychiatry nurses to be taken out of the country, the red list. But that doesn't mean that you cannot go out an individual. Why not? So they have raised concerns, and it's now a discussion. You can Google that online. It says that the number of nurses and midwives that have moved to the UK from Nigeria, as of September 2021, we have 1,334 nurses. As of September 2021, so it's almost like 2 years after that. And from Ghana to the UK, we have 336 nurses who have moved to the UK. Personally, I know so many nurses who have moved. I used to work with them who have moved to the UK now. So, and I'm sure you also know at least one or two. So far as in the medical field, you know a doctor who has left to the UK or the US. You know a nurse who has left to the UK or US. So nursing migration is a thing. And if you have the intention of migrating, you never know. Please start now. Start now. You want to go to that school, you want to go specialize. Start the process now. You never know what will happen in the future. They might lay an embargo, or they might tell those recruiting agencies to leave their countries. South Africa went through the same phase where nurses were being recruited out of South Africa. So they had to stop some recruiting agencies from taking their nurses out. So what the nurses were doing was they were migrating to Zambia, Tanzania, Kenya, any country they can. Then they applied there and started the process and ran away out of that country into the country of their choice: US, UK, Germany, Finland, Australia, Canada. There are so many nurses in Canada from Nigeria and Ghana as well. Yes. So start the process. Don't wait till they start tightening the system or changing the rules or stopping the recruitment agencies before you start yours. You might get stuck. I'm not saying anything. This is just my personal opinion and looking into the future and what has happened to South Africa in the past. It's likely possible. They would not stop you from leaving. They would just stop the recruitment agencies from operating in their country, which they have the right to. So if you have the intentions of going out of the US, out of Africa to go work, seek greener pastures, obviously the specs are high. There are so many reasons why you should migrate. If you want to progress in your career, if you want to specialize, go to school, there are so many branches of nursing. You have here a vast oncology, dialysis, psychiatry nursing, midwifery, occupational health. I can mention a gazillion. You can also check them online. The schooling opportunities are here for you. If you want to practice in a field whereby everything you read in a book, you can physically see them and relate to them, trust me, they are here. The technologies are here. All those things you read in the book are really done in real life here. That is good for you. If you want a better future for your kids, they are very young ones, and the opportunities are here for you. So these are some of the reasons why you should migrate. It's so expensive to migrate. You need a lot of patience, a lot of paperwork and money to start the process and see it through finish. It's very frustrating. Your paperwork will be so stressful, delaying. Some of them get missing. My application got missing. I had to restart. Even when I was living in the US and applying to work here and getting my transcript and things from Ghana, everything was a mess, but I waited. I never gave up. I kept doing it. So you out there watching me, you that have a family member who is a nurse, who is struggling, you think they deserve better, they are very brilliant, but the system is not letting them function to their full potential, encourage them, share this video with them, give them reasons why they should start now, because tomorrow waits for nobody, and the better time is not going to come. You're not going to get the money that you're waiting for to start a process. You have to start from somewhere, and as you go along, you figure it out. Yes, so nursing shortage, until our system, until our hospitals in Africa do better, get the equipment we need to work with, and we stop improvising everything they ask you to improvise. You have to improvise every little thing. I remember how we used to buy real condoms and put a thread on it and tie it somewhere and flip it inside out to make it use it as a condom catheter. I've seen condom catheter here and I'm like, oh my god. Disposable thermometer and everything, and these things make your workflow easy. You are not breaking your back to lift a patient manually because the bed will not come out, or the patients are sleeping on the floor because lack of bed. It happens in some Western worlds as well. I'm not saying it's perfect, it's a perfect situation, but it's a little bit better. If you want to practice the nursing that you've seen in videos, you've seen in movies, you can have the opportunity. So start the process now. Don't give up until the system decides to fix itself. Pay nurses better. Get the supplies they need to work with. Make management better. Have courses for you to upgrade and go to school, whereby you don't have to wait for 5 years of 7 before you can get a study leave and go to school. By that 5 years, you are exhausted. By that 5 years, you have children, you have more responsibility, you have bills to pay. You're just going to be living hand to mouth. And the courses are very limited. You are offering midwifery as a diploma, and these countries are not taking you because you have a diploma. The courses are limited, and the curriculum doesn't really match up with what the Western world is looking for. So you feel stuck. So until the hospitals and the government and the health system do better, nurses are going to leave, and nobody can change that. Nobody can stop that. Even if you lay an embargo, a traveler who is desperate to travel will do whatever it takes to travel. Yes. So we need to start speaking to issues. We need to start raising concerns. Unfortunately, some of us have gag order. We cannot speak. We cannot go on strike. So we don't have a union. So we can't say whatever is bothering us. You can't go on strike. So you just have to stay there and take the small salary. And you can make a living with that. Nothing is being regulated. Your rent in a good environment even is more than what you earn as a monthly salary. Meanwhile, you have kids, you have school fees to pay, you have other responsibilities, and it's not matching out. Yes. Unlike here, where you live, the cost of living will match how much they are earning, how much you're earning, and you figure it out and do little savings. It's not rosy, it's not perfect. Don't quote me wrong, but embark on that immigration plan you have. You've had it for years. I'll do it. I'm urging you to do it now. You never know what tomorrow would have. Maybe these countries will even stop immigrants from coming in. Your country might not lock you down or put an embargo, but the country you're trying to go inside might put a little clause or something to tighten the system that will prevent you from coming in. Or you might end up coming in and you wouldn't be able to function as the doctor that you are, the radiographer that you are, the nurse that you are, the educator that you are. So do it now. And thanks for watching. Share this with everybody. Nursing shortage, what is going on, and why we need to do better as a continent. And I'll see you in the next video. Love you.